Thank you. Okay. So welcome, everybody. Today, we're going to do a brief overview of Work Basket. So this is just to get you familiar with what Work Basket is and that to kind of ask you to start looking at it on a regular basis. We will be fine tuning the notifications that each of you get in Work Basket according to your role. But we wanted to show everybody where it is, how to delete, how to look at items, how to delete items, how to take care of actions in it. So from your home page, you'll go to the upper right-hand corner to this yellow hyperlink here that says you have Work Basket items. Everyone in here should have Work Basket items. If you do not, please let us know right away. And we'll set you up, but everybody in here should be set up. So you'll click on, you have Work Basket items. And then you will get this page here. So I want to talk about a couple of things. First of all, this box here, my tasks, you're going to want to keep that clicked. If you unclick it, you'll get everybody's tasks for the notifications that you're receiving. So you want to keep that checked. You don't want, unless you want to take care of other people's action items. But if you only want to deal with your own, you're going to keep that checked. You don't need to do anything here with the teams. And if you wanted to export this information, you could export it as a PDF or a spreadsheet from here. So in Work Basket, there's three categories. There's action, case communication, and notifications. So case communication and notifications are just like they say they are. Notifications are just things that it's just notifying you of something. So for example, for someone in intake, they may get a notification every time there's a new admission. Or you may get a case communication if there are notes in a clinician, in a patient's encounter. Those types of things would come here. They require no action on your part. And you can see, I'm gonna uncheck this just so that I have some items in my case communication and notification. So you'll see here, I have 246 action items right now. And in a second, when this finishes loading, I will have about 4,528. So you really don't want to uncheck your my tasks. But if I go to notifications down here, these are items that it's just notifying me. So I would go in here and I can see that something was received. This ERA 835 was received, and this is just a notification. So I can just click this box. If I've looked at all three of these and I want to delete it, I can just select delete and those are gone. There's no action required for those. Under case communications, and then it goes back to my tasks. So case communications is the same. There's no action item required. It's simply a notification. So under action, these items will require you to do something to remove them from Work Basket. So for example, you will get notifications if your compliance items or you'll get an action reminder if your compliance items or your license is due to expire. So it's an automatic notification through Care Efficient that maybe your driver's license is ready to expire, or you have to update your auto insurance information, and that would be here under associate. And so under associate compliance, you would go in and you would be able to see what item needed to be taken care of. I'm going to use this action item as just an example. So here, this one is in white, which means it's a new one. And I would click on this pencil and that would take me to where I need to edit the information. So that would be, I would go in and I would fix this. And then when I go back to Workbasket, it would be gone. Takes about 3 minutes for it to fully accept the change and then update the Workbasket. So if you're really fast and you correct something and you go back to Workbasket and it's still there, that's because it takes about 3 minutes to reload. So you'll see, if I go to clinical record, I want to show you there's a coloring system to Care Efficient. So that one under agency that we were looking at was white. That means it's a new notification. Depending on the notification type or the action type, new could be it's less than 4 hours old or it's less than 24 hours old. It just depends on the urgency of the notification. Yellow would be the next level. That's called level 2. So it's not new anymore. It still needs attention. And it could be anywhere from more than 4 hours old to more than 24 hours old. Again, it depends on the action type. And then red is, it needs to be taken care of. You've gotten warning 1 and 2. This is your 3rd warning, and this stays red until it has been edited in your Workbasket. And it stays in your Workbasket for 45 days. But then it comes back as a white item. So it never truly goes away until you make that edit and make the correction that it's asking for. So for today, all we're asking is that at sometime this week, you go into your Workbasket, you begin to familiarize yourself with the items in there. If there's any questions, I recommend, you can always call IT, you can call me, you can talk to your director. But I think the directors will be looking for some feedback on what items are really helpful to have in there. What items would you like to see in there? We've given you some things that we think will be helpful for your particular role, but feedback on this thing as we fine tune the Workbasket for everyone. That is the Workbasket. Are there any questions on Workbasket in particular?
James says the hyperlink, I guess.
Okay.
Yeah, I can't. Look on it.
Okay. So I'll see why you don't, and we'll get you set up today.
Okay.
No worries.
I don't have one.
Okay.
So the role, they're both PT assistants.
Okay.
LVN, right?
Okay, yeah, that's it. Yeah,
It's the role.
it's the role. So
Okay.
we will, and that's just because I apologize. We did point of care clinical, and we haven't done point of care paraprofessional yet, so we'll do that.
Yeah.
Yes. Thank you. Any other questions? Okay, I'm gonna hand it off to the next item.
Good morning, you guys. It's Leslie. All right, so I need to sign my out.
So Leslie's gonna go over missed visit notes and entering pay only codes. Found.
Yep, all that fun stuff. Okay, so I'm gonna start with showing you guys how to, what we do when we have a missed visit. So, so basically, you've got, let's say you have 2 visits in your week scheduled for, to see the patient. And you're only gonna send a missed visit if you can't make those 2 visits in that calendar week. If they cancel on Monday, you don't send a missed visit note. You try and make that visit up later in the week, so you can keep that frequency that was sent and approved by the doctor. So let's say it's, I'm gonna put my patient. Fake patient. So I had a visit for her on a Friday. I called her in the morning. Hi, Mrs. Moran. Just want to confirm our appointment today at 10. She declines. Oh my gosh, I'm going to see my doctor. I don't feel well. I can't see you today. Friday, not going to be making that visit up this week, so we do need to notify the doctor. So we are creating an interim order kind of in quotes. It's not really an order, but it's a way to fax the doctor and notify of the missed visit. So what you're going to do is you're going to go to orders right here. So you're in your patients, and just to remind everybody how to get there. I'm going back to one of my fake patients. So here she on the top. All right, I'm gonna grab her here. Oh yeah, it's not, you don't see it because I'm coaching a PT assistant, but view patient encounter. That brings me to her. Orders. You're gonna go over to the 485 line, so you can tap on it. It will turn yellow, so it kind of lets you know kind of where you're at. Click the drop down, and we're gonna add. You're gonna choose the top item. Add right here. Add interim order. You're going to select the type of interim order. I'm scrolling down to missed visits. Effective date. I'm saying that I missed a visit on, I have to do this on a fake date, before we went live. I'm saying it was a Friday, the 9th. Clicking save. Now, here's the form. So, and what we're gonna have you guys do is we're gonna do a little, because there's only one cover sheet for any fax to a doctor's office that comes from us from Care Efficient. And it has to do with, please sign this plan of care, please review this plan of care, please sign this so we can continue to treat your patient. Well, this is for your information only. The doctor doesn't need to sign this, doesn't need to return it. So we're gonna just add a little extra in here and say something like signature not required for your information only. So just to try and hope the doctor sees this. And then missed PT visit on 4/09/21. Typo. Patient decline visit going to PCP this time. And you're going to come down. You're going to see your doctor's name populate here. So this is who it's going to. And then we're going to do the same thing like we went over last week. We're going to enter our signature. It knows I'm me. I'm going to hit accept. You're going to check the date you're sending this. Well, I would have sent this on Friday the 9th because, when I was doing my charting for that day. I'm going to enter my approval signature here, that orange kind of hyperlink thing. Accept. And then I'm going to do one more thing. Approve. And then I can say save and close. Always use save and close. And now you see it right here. See, it lives in this area called orders. It says missed visit note. Okay, it should say approved there. So let me go back. I must not have done something right. Sorry, you guys. That should say approved. Pardon me?
It said you had to do the doctor's address, I think.
Oh, okay. So I ignored something. Let me see here. Did I have a warning?
Hamburger on the scene address.
Well, that's not good. Okay, well, let me see here. All right, save and close. So that's, that really shouldn't have happened. So, under physician. See if I can add a physician. Yeah, no, I just want, well, it really should have said approved. I'm sorry.
Just make up an address.
Yeah,
Ours.
I'm just gonna add a new physician. I want to see something. Go back into it. See if that worked. There it is, right there, approved. So I just added fake doctor, oh, he's not fake. Dr. Dial. Okay, so that's what it should look like. When it's in that status, you've added your missed visit order. It should, when it says approved, medical records, that puts it in a state or status that allows it to be faxed out. Okay. So now, let's say I didn't call Mrs. Moran that morning. I'd spoken to her the night before and I showed up at her door at 10 o'clock. Oh, honey, I'm so sorry. I can't see you right now. I'm about to get in the car and go see my doctor. I need to be paid my mileage and the not home, not found fee that we get when those things happen. So remember how we showed you guys last week with mileage? You're gonna leave that visit on your calendar and use it to get your mileage for that day. And then the last piece of the puzzle is you're going to, you want to get paid that fee for, showing up and then having her decline at that time. So you are going to go to your home page. And it's down at the bottom with your mapping and directions. It's called Add Pay Only.
Just as a reminder, what Leslie's showing you is for patients that are not home, not found, that are found in care efficient. So if your patient is still in McKesson, you would do what you normally do in McKesson. This is currently now we have a good number of patients in care efficient and a handful of you guys have experienced of a not home, not found and the patient's in care efficient. What do? You would not go into McKesson and try and do it. Leslie's showing you how you do it for those patients in care efficient.
Right, and yeah, these things are starting to happen. That's home health. So you're gonna go through each line item. So you're gonna need to know which agency your patient belongs to. OIN is for the Ojai region. So you're gonna, if your patient's in Ojai, you're gonna pick this. Your patient's in the kind of belongs to like the Thousand Oaks office, that's your over the grade patients. Is Camarillo in Camarillo
is TIN.
TIN, yeah. Team 1 and 2 is TIN, okay? If your patients are in teams 3, 4, 5, or 6, that's VIN out of the Ventura office.
Except for 5.
Except for 5 is
OIN.
OIN.
5 is OIN. 5 is
Ojai.
Ojai, excuse me,
Ojai.
yeah. Ojai's 5, 1 and 2 for Thousand Oaks, teams 3, 4, 6. Thank you for correcting me. 3, 5, Oxnard, Santa Paula, Fillmore, Piru, and Ventura, the VIN. I'm in a training patient, so I'm gonna go up here and pick this. Okay, so I'm gonna pick my patient. I'm gonna go down. I can just type an M, that gives me my little shortcut. Associate, I'm gonna type the letter D for my last name, just to prevent, just to make it go faster. You certainly can scroll if you choose. Services. Okay, so here's a bunch of stuff. So I'm a PT, but you will see this code for not home, not found in all disciplines. So I actually can, well, I can do a P, yeah, and get to PT, not home, not found. Okay, there's also, this exists for OT. Oh, I was before P, sorry, you guys. There it is. It's for RN, it's for LVN. Let's show LVN. Where are you? There it is. So that's what it looks like, okay? It's for everybody, it's for MSW. Everybody's got their code. So I'm gonna go down to P. I'm gonna enter this. You do not enter a time. This is different than McKesson. McKesson wanted you to capture in 1 minute, because that put the patient in your order of the day, helped you get your mileage, got mileage for you. No no times go into this, the pay only. section. Oh, somebody needs to mute.
You guys need to mute yourself.
It's fine.
Sonia,
Sonia?
Yes,
you need to mute, sorry. We can hear you. Thanks, my dear. Okay, so like I said, no time. And then check the date. So this didn't happen today. This happened April 9th. So kind of take your time when you go through this, double check it, and then just hit schedule and continue.
No comments? You don't have to write a comment?
No,
Okay.
you can write a comment. So, see right here, you guys? If I scan over this, it puts it on my calendar. I entered my not home, not found for Princess Moran right here. And see that? Patient not home, not found visit. So you guys are seeing your mileage show up on your calendar. And PTs will see their cosigns show up on their calendar. So anything you're entering as a pay only, it does get reflected. So that way you kind of know, okay, I did it. It's a good double check.
Could you run through that one more time, Leslie?
Sure, I'd be happy to. Okay, so I need to be paid the not home, not found fee. Patient declined at the door. So I'm going to select agency. I'm doing the training one right now. I'm going to select my patient. Let's pick a different patient. I'll go for Flannery. Associate, myself, I type a D. I can find myself quickly. Service type. Let me just show you. So RN, that's what yours looks like. David, let's find you. There. All right, so, but I'm gonna go back and do mine. Maybe she told me to come back later. I said, okay, I'll come see you at 3. And then she declined again. Maybe you would put it in twice in one day. A question from Alex.
Yes, question. If nurses are on call, how to place on call service? Because those items work if you put patient name, nursing name, and location. If you don't put nursing name or patient name, there's no option to choose on call.
There is. I'm gonna let me. I think we're gonna get to that. Yeah, but that's a great question. Okay, so again, I'm picking because I'm a PT. I'm picking that. Now, if I did want to put a comment, declined at the door, not feeling. So Lorraine. Okay, so I can put a note in there. I'm gonna and I'm gonna hit save and continue. Okay. Now let's go back and take a look because the note I just entered will show up. Flannery, Princess, look, there's a note. So if I scan over it, and this is a trick, you guys, if you want to show the service descriptions, do you see where I am up here? So this is the 9th of April. See, I'm in April. I'm going to the 9th. And it kind of, it takes those little bubbles, the green bubbles, and it makes them, taller. And you can see what's in there. You don't get to, so right there, there's my Flannery not home, not found. And if I click on the note, it says, declined at the door, not feeling well. Nobody else sees that lives on your calendar. So this is not a place, I had one clinician say, oh, great, if I put a note in, then the PT assistant will see my response to my review of his note. I said, well, I realized this just lives on your calendar. So this doesn't go to anybody. This is not for communicating with other staff members. This is just you documenting what happened. And in fact, I think it is a good idea to put a note in there so we know what happened. Okay,
Leslie,
yes,
is there a PTA box or do we go under PT for the not home, not found?
there is a PTA. Yeah, there is. Yes, it is there. There's a PTA. It's PTA assist dash not home, not found. Yes, yes, there is. Okay. So, so let's talk about the case. This has already come up twice. It'll circle back to what Alex said. When you don't have a visit to attach it to, because we've had 2 PTs knock on a patient's door and they refuse to be admitted. I don't want home health. I'm good. Go away. It happens. So you're going to, we'll just choose our agency. That patient is not active, so you will not find that patient in this list, so you leave it blank. Associate, this happened to Keely. I'll put her name in there, Keely Merced. And service, she's gonna pick PT not home, not found. So she'll get paid the fee for, and then she can put patient declined admission to home health.
You don't put the patient's name there.
And you can put the patient, yes, and put the patient, yeah. Probably want to put that first. You know, whatever. Snow White. All right, so anyways, that's what you would put in, and you'd put save and close. Rick, I can show
The
you.
reason that Leslie's showing you this is because that patient, since they weren't admitted, when you go to select the patient, that patient won't be there.
Yeah,
So,
yeah, and these are, okay, when I chose VIN, this drop down applies to every patient that is attached to team 3, 4, and 6. So if you're trying to find your patient, you're like, they're admitted, what's going on? Oh, you chose the wrong agency. Oh, that's right, this patient is an OHI patient, and now I'm gonna find that patient.
so it's a little different way of thinking. We're used to thinking in teams, and now you need to know it's identified by the agency. So we have right now in home health, we have 3 agencies, TIN, VIN, OIN. And you guys are used to searching by team. So that's why Leslie was clarifying, what TIN stands for OIN and VIN. We are working, and there will be an enhancement where we will be able to put in agency and just put in LMVNA, and everybody can be there. Right now, that's not how it works. So if you check the 3 agencies and you don't see your patient, it's probably because that patient was the patient that wasn't activated. So it's just little ticklers that you're always going to normally have your patient there and you're going to find them. If the patient wasn't admitted, they're not going to show up in the drop down for patient.
Yeah. So, and now I know there's other things that you were paid for, like Alex was mentioning. There's the, there it is. There's the on-call. There it is, north and south. There's breaks. See here, there's, I'll show it to you in OT break 1 unit, OT break 2 units, depending on how long of a day you work that day and how many breaks you are due. But right now, all that extra stuff, meeting time, orientation time, see there's orientation, OT meeting, all of that should still be in McKesson. We haven't done the switch, okay? So you're only gonna be using pay only for these not home, not found, if the patient is a care efficient patient. If you have any questions, please call me or your supervisors or directors, okay? So, and, the COVID thing, if you're seeing a COVID patient and using the full PPE, you are due that. There is you get an extra fee for that type of visit. We are continuing to have you guys use the preceptor code, OT preceptor. Let's go down to show RN preceptor. Give a shout out to the LVNs. Sorry, you guys. Sorry. There we go. LVN. So that's where the COVID fee goes. Right now, we don't have any on service, right, Jeanette? Correct. So that's fantastic. So, and then I do want to teach the physical therapists how to do their co-signing, but I don't want to do that with everyone else in the meeting. I don't want to take everybody else's time on that. So at the very end, if you can hang tight when we excuse everybody else, PTs, stay on the line, and I'll go. Okay, so I'm done.
Whoever has the bird, if you could please mute yourself. There's talking in the background and that bird is there.
I have a question, Leslie. Just a moment, can we?
Thank you.
Patrice. Patrice.
Okay, thank you.
Yeah, I was here first.
Okay, I'm on the meeting. Thank you.
I thought it was Jessica Farrell.
Oh, Patrice has birds too. Okay, thanks you guys. Okay.
Lorraine, question. If you have to move a patient, how do we move a patient? If they cancel their service and they want to be seen later, how do you move it?
You mean in the same week?
Yes, with
You
your
drag it.
I tried, yeah, remember?
Okay, when you guys, you guys now have the ability to drag your patients around. The one thing is, I'm gonna close this because it makes the calendar a little, and you can just do that on the fly, however you want to see your calendar. On the tablets, it's difficult to capture a visit and drag it.
It's hypersensitive.
Yeah, so Rick was able to do it. Rick Riley was stopped by to go over some CE stuff, and he was able to do it with his stylist, but it's not easy. You guys are going to be getting a mouse for use with your tablet. It's much more, it'll be much more user-friendly for that type of
So it's a straight drag.
interaction.
Yeah, it's real light though. It's-
Yeah, because I couldn't, I was like,
If you use your stylus, kind of push and hold for
Yeah, I
a
remember
second
push, hold.
and
yeah,
then, yeah.
I remember, and then I couldn't do it. It kept saying I wasn't available.
Oh, that's, yeah,
Okay.
it's a time frame thing there.
Yeah, so I didn't know how to correct it, so it wouldn't let me move it.
Okay, all right. Call me
Okay.
next time. you're
The
coming.
other thing is too, you can always call Kathy and she can move it for you too, because ideally we want to know, we want the office to know your schedule. So if you do, but you can move it yourself, but please let Kathy know. Or.
Yes, or
let-
Catherine
right,
and
Yvonne,
Yvonne.
Catherine.
Yeah.
Yeah.
Please don't move visits without letting the schedulers know, guys.
If
Because
we-
it
if-
does affect how the scheduling for the next day, even
Yeah.
more so for nursing staff than.
So if we move the appointment, and Kathy doesn't get that on her screen,
No, she'd have to go in and then look at your schedule.
I see.
So she's thinking, oh, Rick's available on Thursday for 5 visits, but then you went and moved 2 of them to Thursday.
I got you.
She's thinking I have 5 visits to give you. Then she goes into your schedule and she sees, oh, there's 2 there now that I wasn't aware of. What am I gonna do with these 5? So you wanna keep your scheduler informed of, what's going on.
Yeah, when I do press on it to go over lightly, it comes up with the pop-ups of add note, view print, edit. Before, I remember in practice, we just tapped on it and then moved it over. So I wasn't sure why I was getting these.
It has to do with, I think, how it's the touch of what you're doing.
Yeah, if you hold it too long, it's like a right click with the mouse.
Okay.
Okay, so now Delia is gonna go over how to add wound photos, and also she's gonna talk a little about our home calendar.
Good morning, everybody. I'm gonna start with the wound photos, and I already have some patients on my calendar. I've opened up my calendar, and I have Princess Gallegos, who is 100 years old. She's in pretty good health, except for some hypertension and some asthma. And then she just had a bicycle accident, so she has some wounds. So we're gonna go ahead and open up the visit. And I've actually already started charting on her, so I'm just gonna go to the edit part of the Oasis. And so if you're starting your visit and you're clicking next, because you're charting, I've already done that part. I'm just gonna go right to the area where you would see your skin and your wound assessments. So you're gonna go to Integramentary Assessment. This is the area where you're gonna be able to chart any of your wounds. Now, you can always go straight to Apply and Demand. My recommendation is that you start right here where it says Add or Edit Wound Assessment. This will take you right to the picture of the body where you can select the area of the wound. And so I would start here, and you'll be able to see the reason why in a little bit. So I've added her wounds already. I've taken pictures when I was at the home, and then I came and started charting. And so I've added some wounds. We have a total of 3 wounds, but as you can see right here, that second wound, I resolved it because I added it to the wrong location, or if that wound is actually truly resolved, you could resolve it. So since I've added it to the wrong location, I try to create another wound the same, but it won't let you edit the second one. So it will always tell you that now you have a 3rd wound. And then of course the 4th one, because I have a coccyx wound right here. So I have a total of 3, but it shows here that I have 4. The reason I'm telling you that is that we're trying to make sure that we all chart these wounds the same way. It's super important because once we upload the pictures don't link to this area, but you do want the same type of information added to the picture. Once you upload the picture, you want the same information. So when you see the picture and you're charting on your revisit, you can say, oh, let me go to the shin left lateral proximal picture so I can see that wound and see what it looks like to see if there's any changes. Okay, so this is where you are. And I can add one really quickly. So say this is another wound that you're adding right here. This is the right arm. So you would select what type of wound you would add. So let's just say this is the correct area that you are charting on. You would add that in, and then you would put the wound description. Okay, so I've had my wound descriptions right here. Number 1 is an open laceration. She fell. Number 3 is going to be also a status post fall laceration, but she has sutures in that place. And I just wrote in here under comments, I wrote that the sutures are in place and that the sutures were put on 4/15. I wrote that in there, so if we ever have to take out the sutures, okay, so that was put on 4/15, it's 10 days old. Maybe we don't have an order, maybe we have to get an order from the doctor, or maybe on the revisit, you don't ever go back, another nurse goes back, so at least that nurse knows the date. Okay, so I'm gonna log out of this, and then now you would go on to Apply and Demand. And then I already selected these, so these are grayed out. But you can see how this one will say wound 1, wound 2. But then again, if you go to a different type of wound, like a pressure ulcer, it will say 1. So when we add the documentation for the pictures, the photographs, you're going to use the numbers from this other area where it says Add and Edit Wound Assessment. Not necessarily from this, because it will rename the wounds 1 and 2, ulcer 1 and 2. So that could get a little confusing. And I'm going to show you what that looks like when I've already documented on that. Just going to go to that area where it says wound, other wound 1. So I added here the same documentation as I did in that area where it says edit wound assessment. That was over here before. And then I just put what type, it was a laceration status post fall. And, sorry, this one. So let me just show you one more. So I'm gonna go to wound 2. Okay, so this one I added again, that same exact wording that you got from your initial body of the picture of where you added the wounds. And this is again another laceration, but this has sutures in it, and the sutures were placed on 4/15. And then the last one that I did was a pressure ulcer. So see how that one says that's one again? So you just document same type of wording again. Okay, so that was how to add your documentation for your wound addendum. And I know I'm just gonna go over pictures, but I wanted you to see where I'm gonna get the wording from. So I'm gonna go back. So if you would have closed out, you would have completed your chart, you would have approved your assessment. I'm gonna go back to my patient now, because now I'm gonna add my pictures. And I'm gonna go right here where it says encounter. You can go to different areas to pick up your encounter. You don't have to go to your bubble. As you know, you can put your patient's name over here, and that will take you to the encounter. You can come up here and select patient encounter. So there's different areas you can go into. So now I'm in the patient encounter, and right here, all these are your clinical tabs. I'm gonna show you 2 different ways you can add pictures, but the first one I'm gonna choose is under the docs tab. And I've added other pictures before for this patient, but today we're gonna pretend like none of this is here. I'm gonna upload a document. I'm gonna choose a file. And this isn't my desktop, so it's gonna look a little bit different. So there's any pictures in here, okay. Trying to see if there's a picture that we can upload. Okay. So I've added a picture. I'm going to leave it under encounter. I'm going to select, we're adding photographs at this point. So we're going to select photographs under document type. Under document status, we're going to select no action needed, because there's nothing that anybody needs to send from this picture, anything. So under description, now this is where you're gonna type in what the description is. So I'm gonna type in wound number 1. It's gonna be that shin left lateral proximal. That's the same type of wording that we used when we first selected the wound. Here, I really don't have anything else to write for this one. I'm just gonna say nothing. And then I can either upload and close if you're done, or if you need to walk away and you can't finish your uploading of your pictures. Or I can upload and add more. So this is if you have multiple pictures of wounds that you need to upload. So I'm just gonna say upload and more. And then, of course, I would have to choose another file because I have to choose another picture. And I'm just gonna select one of these for now. And then you can see that the picture will be uploaded. Again, it's going to be attached to the encounter. The document type, you're going to go again and you're going to select that it's a photograph. Document status, you're going to go in and you're going to say no action needed. The description, so this is going to be wound 3 because that second one wasn't, I resolved it. So this one's wound 3. It's also on the chin, sorry, left medial. And then this one, I'm actually going to write a note because this one, I'm going to say sutures in place. And then 415. And then I could select upload and more because I have one more picture, but I'm not for time purposes, I'm not going to do that. I'm just going to say upload and close. And here you have your pictures with the correct name for them. So if anybody is looking for those, they know exactly which wound to look at. The second way you can upload a picture, and this might be a little bit quicker, is to attach it exactly to the visit. So if you did a visit, say you did either a starter care assessment or you did a revisit, you're done with your charting, you already completed or approved your charting, you've gone out, now you come in back into the patient encounter, you're back at your clinical tabs here and you've gone to your service note. You're going to look for your visit that you want to attach the picture to. This is a patient that has only one wound and one picture. So I'm going to select this one, and this is a revisit, and there's only one picture here that we want to upload. This will only let you upload one picture. So I'm going to go to, oh, sorry, I should tell you exactly. So I'm going to go right down here to the arrow that's facing downward, and I'm going to select the upload additional document. So now we're back into that same area where we are upload a file, where you're going to choose your file. You're going to select what the status is. Notice this one did not let me select a photograph on this. And this is just because you are attaching it right straight to the visit that you did that day. But you can write the description of that wound. And then you would just, whatever wound it is. So if it's wound 4, because that's the name of the wound. And this is my toxic midline picture. And then you just upload and close. Oh, it's gonna want me to choose a file. Okay, so now you can upload and close. And you can see that your picture will be here. You can open it and view it. I'm actually not gonna open it because I'm not really sure what that file was, so I don't want to open it. But if you're doing it, your pictures from your tablet and you're uploading pictures from your tablet, you will actually be able to upload from your photographs. And you're just gonna go to your photos instead of having to look through those files. You're actually gonna look through your photographs and you'll be able to choose the right photograph to upload. Next, I wanted to show you what it looks like when you've done your visit. So these are my visits. These are visits that need to be done. They're green. I'm going to go to, Zan has given me permission to view her calendar. Hers is better because she's actually seeing patients, and so you'll be able to see a little bit better what it looks like. So notice that she's actually seen patients. She has charted on them, and the note says that it's complete. And just hover over the note right here. So she's completed her notes. Okay. I'm going to go back a little bit just so you can see what her notes that are not complete. This one's going to say open service note. So she still needs to complete that. So when you've done your note, even if you're complete, this one's complete, it still will remain green. It doesn't turn it blue just because you completed your note. The reason it's still green is because this needs to be verified. So payroll will verify that everything's ready to go and you're ready to be paid. So once that's done and you're gonna get paid for this visit, this will turn blue. So when you're doing your 2 weeks, this week that we just finished right here. So this 2 weeks around here, this time frame, you should start seeing a lot of stuff turn blue. If you're not, you can always call your supervisor or your director and ask them, you know, I've noticed that my visits up here, we already passed a pay period and they're still green. Did I get paid for them or not? So just ask us so we can check for you. So once they verified, it turns blue. If you've gone in there and you've done your mileage, you're gonna say here, this is for your mileage. And it's also gonna turn blue. If it's not verified, it will still be green. Questions on either thing, whether it's documents or
Questions?
anybody from the phone?
Oh, I think Mary has a
The Zoom?
So we're not taking pictures with our phone anymore. We're using the actual laptop that we have.
Tablet. You can use pictures from your tablet. It will go directly to the tablet. But I think James, you can take pictures from your phone and it can be linked to your tablet or?
Yeah,
So I'm more familiar.
if you use Google Photos, it's installed on your phone already. Just tap on Google Photos. It should automatically log in, but it's the same login as your Chromebook or your computer.
Yeah.
And then once you log in, you tell it to back up and it'll synchronize to the cloud. And then when you go on your tablet, which also has Google Photos, actually, it's already installed on your device there. So
Yeah.
when you click on it, when you hit upload image or whatever the verbiage is,
Says turn on backup.
yeah, so turn it on. And then you click on attach, you click files, and Google Photos is one of the options to browse on the tablet. I can show you later, Mary, if you want.
But I think it's a lot easier to do it from the tablet. If you take your photos from the tablet, it's just right at your fingertips to add the photos to documents.
Yeah.
That
It
is,
just seems like there's a lot of steps, James, to what you're doing.
it's a one-time deal. Once you,
It's a one-time deal.
Yeah,
Okay, then call
once
IT.
once you do it,
have to have James show us how to
Yeah,
do that.
yeah, and so that's up to you guys. If you wanna, you do it on your tablet, I can help you load it. If you wanna use your phone, call IT. And, okay,
Okay, so the last thing, Jamie is going to talk about hospitalization and discharges.
Jamie, take it away.
okay.
Okay, so we only have a few minutes left and I want to be respectful of your time. So we're not going to spend a lot of time on this. Last week, we said when your patient, if you find out that your patient is hospitalized, what to do. And that still is the same process. What you're going to do is you find out your patient either went to the ER, your patient was hospitalized. You're going to go into that, you're gonna first send a click to your supervisor and your team members. You could include your director just in case your supervisor is off. But really it will be the supervisor in the office who's doing most of the groundwork. But please make sure you let your team members know so that they don't make the effort to go to the patient's house. We're also going to have you enter a note in that patient's encounter. Under the note section, I guess I could sign in as me, I just didn't want to spend time, but are you still signed in, Dennis?
Yes.
Okay.
So, and it's really important, you guys, when you find out that the patient's been hospitalized, you talk to the daughter, the husband, patient themselves. When did they go? Where did they go? What facility and why? It's just really helps us. So instead of just, oh, okay, just keep them on the phone and ask that information. People, you know, because when we fill out that, when we put them in a hold status, it asks for the specific facility that they were admitted to.
Yeah, so I'll put this patient, and we're gonna have them put them on hold, aren't we? Or we're doing that, okay, right. So all you're doing is, when you find that information out, now I'm in this patient's encounter, you're gonna go to notes, you're gonna do add note, and you're gonna pick just, we have a hospitalization yet?
Hospitalization notified.
Here, and you're gonna say,
We don't have,
her patient's daughter. Patient went to ER at CMH due to shortness of breath. Because I chose hospitalization notify, and then I hit save. You see how it's gonna be right here on this patient's header. So in the notes, so just as a little reminder, everybody, all of your patients, this area contains a lot of information. It's kind of like the non-clinical note and a combination of other things that was in McKesson. But this would be a good place to look, just when you open up a visit, is there any new note that I need to know? So if accidentally someone left you out of the click because they didn't realize you were going, you know, always just get into the habit before you do anything of looking in this area. Because this is a notification note, it goes right here. If I had chose a different note that doesn't say notify, I'll show you. If I just picked a event note is not a notify, let's just say I did that. And I hit save. That note's not gonna show up in the header. It's gonna, I'll get out of this so you would see what, you would go, you're now in on this patient and you're on the service note tab. The one that has notify shows up here. If you wanna view other notes that aren't notification notes, they're here. So it's just good to look in this area. You're gonna learn some things about your patient possibly. And then behind the scenes, your supervisor is gonna do something like this. It's called place the patient on hold. And what this will do, visits, will decide if visits should come off or on. If you see that your patient's in a hold status, that's another indicator that, hey, something's up with my patient, and you'll see that. And then behind the scenes, your supervisor is going to investigate to see, you know, what actually happened with the patient. Were they admitted? Were they not admitted? And if they were admitted, then Joyce Steingold, just so you know, she's going to complete the transfer to hospital. This information really must be timely, because then if we get the resumption of care orders and we haven't done behind the scenes of putting the patient on hold and doing the transfer to the hospital, we can't enter the ROC orders. So we just need your participation and help and keeping everyone informed on what's going on. But the good news is you don't have to do anything past that. We're not asking you to do the transfer OASIS or follow up with the hospital. We'll do all that in the office and get the patient, what they need so that they can become a resumption of care. Any questions? Yes.
How do we get notified that the patient's on hold? Once you place them on hold, do we get some sort of a notification on the
Like in your
patient's?
work basket or something?
Yeah, does it come up
Or
through
does
that?
that highlight, does that change colors?
This
or
will
anything?
change colors. So right now, I was gonna do it, but I want to show you
Okay.
the discharge of this patient. So I'll show you a different page that I'll put on hold.
Okay,
Let me do-
So we just click everything, like we don't have to call Brenda or anybody, we just click who you say to click and then.
Brenda was McKesson.
Yeah.
Brenda was the person. So right now, if you have a McKesson patient and they go into the hospital,
Oh, this one's discharged.
this is for care efficient patients. Joyce
Yes.
Steingold is gonna be our but that's just for you guys to know, but your note doesn't go to Joyce. Your note goes to your supervisor, myself, or for the nursing supervisors, Antonio or Cheryl. You can also
With your
your
director,
directives
just
as
in
well.
case they're off.
So
Yeah.
myself and Jamie for therapy, Jeannie, Delia, Antonio,
Cheryl,
Cheryl,
Antonio.
Antonio. Yeah, I said Antonio.
Yeah,
Okay.
so this patient here, when you said, how would you know? I'm gonna place this patient on hold. And because was a patient request admitted to the facility? In this case, I'm gonna say patient request. And it's gonna say on hold date, I'm gonna just put today's date. And then I'm gonna say save. It's gonna ask me, is that really what I wanna do? And then you'll see the options now for this patient. It's either to discharge or to reactivate the patient. So that's how you'll know the patient's on hold. What's that?
Yeah,
And
and
see the
yes.
status over here, thank you, Leslie, is hold. If you click on this little thing here, you'll find out when they went to a hold status. They went to hold on 5/4.
And who put them on hold?
Yeah.
Right. And so if you're wondering, you call me and say, hey, how come so-and-so's on hold? And I'll hopefully have an answer. So this is the header, and that's where you're gonna find information, okay? So now I wanna show you when you're going to do a discharge for a patient, and I'm gonna just show for today, because we're running out of time. You're gonna discharge a patient from the agency. If you're doing a discipline discharge, you're gonna pick a different note, and that's a little bit simpler. So what I wanna show you is, because we had a couple of discharges already in care efficient, and the clinician went out and they're like, I can't get my discharge OASIS, what's up? So what you need to do is, I'll try and do it on this patient, I think I can. I'm gonna go in and do, so before you open your service note, so you pulled up this patient's on your calendar, and you know you're gonna be discharging this patient. What you need to do before you do anything else is you click discharge patient. Discharge reason, I'm gonna say, so this is something you guys need to do. I'm gonna say goals met, I think is it. Okay, discharge to home cell, today's date, order type, anything with the orange thing you need to do, and you wanna pick discharge summary form. And this is then going to populate from your note, and this will get sent to the doctor, the discharge summary. Remember in McKesson, you had to send a note that you were doing this, and then Anna Baker would do this whole big form. Now it gets done automated from Care Efficient. So the orange items here are the asterisk items I completed. This here was from the admission information. This is also, will just populate from the admission information. You hit save. Okay, now the patient's in a discharge status. When I go into to do a visit on this patient, so I have to go to my, I think this patient's assigned to me. Let me see if I can just go to service note.
No, you gotta go to your calendar to
Yeah,
open the
I
visit.
do.
Yeah, so you kind of gotta backtrack a little.
Yeah, I gotta go to my calendar. Find the patient that's assigned to me. Brian, Jamie, where's the last one? Okay, this one?
Yeah. Oh, you
Okay.
can change it.
Yeah, I'm gonna change this. I'm gonna do add page service note assessment. I'm gonna pick Oasis because this is a discharge from the agency. And now I'll have the option to pick the discharge. I'm gonna change this to PT discharge. Discharge visit. That's a good idea, yeah. And now it gives me the option to pick discharge from agency. If I hadn't put the patient in discharge status, I wouldn't have been able to get this. So this is important whenever you're gonna go out, because it's happened and people call in like, oh my gosh, I can't get this Oasis. You know how devastating it is not to get the Oasis that you want to fill out. You also want to remember, guys, Leslie just brought this up, to pick the service code that says, like in this case, where is it? HH, it should say, right here. Service performed, you saw how I had to pick. You always want to pick the one that says HH unless you're doing a hospice patient. But this stands for home health, the discipline that you are, and the visit type that you're doing. And that then is linked to your pay for that type of visit. So if you don't pick the correct one, of course, we can fix it and change it later. But I just wanted to show you guys that you need to do that. Now, of this service note, there's a thing near the end. I'm only going to go to that last page up near the end called Discharge Summary V2. This here is what's going to populate that discharge summary form that we're sending to the MD. So you want to fill out reason for discharge, goal met, patient outcomes, all goals met. Lab data. So for me, I'm a PT, I didn't have any. If I knew the nurse did, we have to still let you guys know what we're going to do about this, but I'm just going to say no labs on this encounter. Patient's discharge condition, he's stable. Patient family district nowhere informed of outpatient appointments, knows how to obtain supplies. You don't have to be super wordy. This is going to the doctor. You just want to let them know patient's discharge goals are met and they know what they need to know. Reason for home health, I'm going to say status post total hip replacement. If it was, you could be generalized wound care, IV antibiotics. You don't have to go in and write an enormous paragraph in here. Patient caregiver comments, satisfied with care. I know I'm spelling things wrong, but education required, block these off. Medication profile reviewed. Of course, we're always going to review the medication profile before we discharge. Retention of information was fair. Resources, they still on Meals on Wheels. If they had, in-home support services, you'd put that here. Discharge visit made, yes. And then narrative note. I'm just gonna do this. Okay, now I'm gonna do save and close. I can't get it to an approved status because I have to do the whole Oasis and everything else. But I just wanted to show you this page. And what happens now is when you go to this patient's encounter and you go to the orders tab, you're going to see that there is, well, normally,
Go to a different patient.
I will, I'll go to, wasn't that the patient I was on though? I'll go to the one I just did Monday before. Since these are all training patients, sometimes it's hard to find. Why is this not coming up? Oh, because this patient's discharged. Okay, so this patient I had already discharged. I was going to show you guys on this one. When you go to this patient's orders tab, you're going to see that there's a discharge summary. It automatically populated. It's not yet in an approved status, but that page, when you complete it, that I was just doing with you guys, you're going to see this is what gets sent to the doctor. This is the latest orders will go to the doctor. The outcomes from how you completed those care needs will show that the goal description, if it was met. And then the area that I just did in that note will populate in here. This one's not done yet, so that's why it's not there. Okay, I know this is a lot. We only spent 5 minutes on it. So when you have a discharge patient, call into your supervisor, your director, we'll be able to help you and we'll get this organized. But I just really wanted, to me, the biggest takeaway from this is put your patient in a discharge status, because if you don't do that, you can't move forward. Any questions? Any comments? Anybody else to add?
Anything in the chat box?
I'll go check.
PTs, do you guys want to hang tight with me and we can let non-PTs? When there's a question.
Do we clinicians put the patient on hold? Is that done behind the scenes? For right now, we're definitely going to do it for you guys. So just when you click your supervisor, that will be the supervisor's role to put the patient on hold and do what needs to be done. As we evolve and we all get more comfortable with the system and how it works, there could be some changes in some of these processes. So we're trying to make it just, at least in the beginning, that you guys concentrate on providing your care and doing your service notes, and then we're helping with, most of the other things behind the scenes. Any other questions?
So I
Okay.
guess can we take them off mute and so have PTs chime in? Do I have anybody who wants to stay on with me?
Let me go.
And those of you that Zoomed, can you please let your director know who you are so that we can add you to the attendance for today? Thank you.
Yeah, send me a click, you guys, if you were in the meeting.
Okay, so Aline is on.
Okay. Unmute everybody. Okay. James, can we unmute everybody? I just want to know if you want to hang tight with me or not. It's one way.
Ask on mute. So my question is,
Yeah, if you don't hear the bird, it's not unmuted.
Okay,
So you put.
so any therapists, are you gonna be able to stay for Leslie to show you how to do the, only physical therapists, because don't have OTAs. Like Randy and Alina and Patty Taylor.
I'm here. I'm
you guys
here.
have
Good.
fits?
I'll stay.
Randy's gonna stay. All right, at least you got one.
I can stay. I'm here, Wanda.
Okay, great. Okay, so I'm gonna give this back to Leslie and she's gonna take it over from here. You guys are all unmuted, so please do your best to try and, hold on, I need to get you a tab. There you go. Okay, thanks, everyone. Have a great day. I'm gonna go deal with those rocks. Oh, here's your slide.
Oh, great. Okay, you guys, let me just sign in real quick. Wait, hang tight, just in case.
Oh, okay, sure.
Think.
Since we have a small group on, Leslie's logging in, what do you guys think of these Zoom type meetings compared to coming into the office? Do you find that you can stay as engaged and it's just as good, or is it better when you come in?
I think it's great.
Oh, okay.
I'm very, I can focus and take notes.
Okay.
Great.
Okay, okay, you guys, who's on the line? So who do I have right now? I have Wanda and Randy. Who else?
Patty Taylor.
Patty Taylor.
Okay, all right.
Alina's here.
Lisa Vincelette. Okay.
Alina.
Alina. Sorry, my dear.
Yeah.
Okay, so what you guys are gonna do is there is a report that you guys are gonna run. So it's under reports. Do you see this right here? And you're gonna go down to service notes cosign report.
I don't know, I'm just guessing.
So now, whenever you get to these kind of things, it's all about choosing, like, we just want to select PT. And our agency LVNs need cosigns too, I guess. And then you're always going to select the agency. So again, it depends on where you're seeing patients. So you might have to look at TIN and VIN, you know, so I'm going to pick VIN for now. You're going to look at the dates. So this is what this does is I've noticed is it automatically starts with the current date and goes back 1 month. So today's the 4th of May. It's going to dump the start date to April 4th. And this is what you're looking for, notes not co-signed. And I'm going to hit search. Oh, I'm so bummed. Everything. So now, I think one of these belongs to Randy and one of these belongs to Mark Whitman. You guys are going to see all the co-signatures needed for everybody that is in VIN. But it's a way to make sure we don't lose anything. Like if you don't remember, because you don't have that note from the PTA living in your follow-up notes telling you, oh yeah, I got to go back and co-sign. So, so this shows who the assistant was, the date of the visit. It was a PTA revisit. And then what you're going to do is if I want to co-sign this from Lorraine, I go over to the drop down. First, I have to read her note. Wanda, I don't know how much time you spent in Care Efficient. Unless it's you that did the visit note, service note, everybody else can only see it in PDF format. Takes a moment. And there's Lorraine's visit. I can see what she did on the task actions. That's your interventions. I can see what she accomplished with the goals. Okay, looks good. I can see how she filled it out. There's my vitals page. How was their pain? Okay, their pain's 0. Awesome. What'd she do for gait training? Where's the functional mobility? Oh, dang, there's still a modest cyst. All right. You know, you look through the note. Okay. So you get to see how they filled it out. Then you'd come back, apply co-signature. And I'm not going to do this because this is a live patient. I'm going to leave this for, I think this is Randy's patient, and Randy would hit accept. Okay. Then you guys need to get paid. So that's a matter of add pay only. I'm going to go to the agency type, VIN. I'm going to pick that patient, CR, there he is. I'm going to pick Randy, you're picking yourself. And then service description. This one starts with HH. Right? Where? Right there. Okay.
There's something wrong.
So you're going to pick that. I do not put in any units. The date that you enter is the date of that visit. I think that was 4/20. That was 4/30. And then you're going to say, you know, agree with PTA or
Who else doesn't have it?
PTA revisit.
Wait a minute, the whole room cleaned up.
Reviewed. Following care plan. Okay. And then I would hit save and continue. So I'm gonna hit cancel because I'm gonna leave this for Randy to do.
That's my patient.
That was you. I was doing, are you sure you want to cancel? Yes, because I don't want to do a real thing. Okay, now, I hope this doesn't spin you guys for a loop. There's another way to do your co-signatures, okay? You're just gonna have to find what works for you. You can actually go to that patient. So let's go to, so you can run the report, reports, service notes, cosign report, or you go to your patient. I have to pull this patient up. Go to service notes. Let's find Lorraine's visit.
I'm down there at 4:30.
Okay, well, there she is, 4:30. And I think if you just wanna, as soon as you tap on it, you guys, you can get that line to turn yellow. I find that really helpful when you have, it gets this busy.
Or 5:30.
Yeah. Okay. And I go over and I've got the same options, but there's more, but I can view the service note. And I can apply my co-signature. So this might be more user-friendly, but I need you guys to know how to run that report. Because what if Lorraine forgot to send you the note, or, you know, just, so there's two ways to get there.
Well, how do I send them a note?
You're just gonna click them at this point, or,
Okay.
you
What am I
know,
doing now?
we don't have, okay, any questions? No questions?
I'm here. Do you have any questions for me, guys, on your patients?
Just call me if it's, I know it's a lot when we show you guys this, it makes sense, and then you go to do it yourself 2 days later and you're like, wait, what did you say? So call me or click me. What else do I want to say? Well, I guess that's about it, but it will show up on your calendar when you do it, okay? So Randy, when you go ahead and do this, you'll see on the 30th, you'll see an entry on the calendar and for your pay only thing, okay? So that's what's kind of nice, you know you did it. So we really want you guys to pick the date of the visit, even though you're doing it today on the 4th. You want to attach it to the day that Lorraine made the PT assistant made the visit, okay? And that's it. I hope that makes sense. And again, call me. Ideally, I'll have a handout on every single thing, but it's just takes time to put those together. And so in the meantime, call me. Okay, you guys, thanks for tuning in.
Thank you.
Okay, have a great day. Bye.
Okay, my dear.
Stop share. End meeting.
Oh, everybody was here.